Hi everyone, this is the last set of slides here for week one. This is the last slides for bone. So we talked about the different types of bone and the functions and so forth. Now we have to start looking at different shapes and sizes and how they were classified. So you remember that when I explained the parts of a bone, I used a long bone like the femur. Well, there's a lot more other shapes than just the long bone. And they tend to be first classified according to their shape. So the long bone is the first one that we looked at as an example for looking at the parts of a bone. Generally speaking, what constitutes a long bone is it's generally tubular in shape. It does have a diaphysis and two expanded ends or epiphyses. It is longer than it is wider. If you think of the femur, that makes kind of sense. Its big thing is it's a lever in locomotor activities. So the purpose of the structure of this type of bone, such as the femur in the leg or the humerus in the shoulder arm, is it allows for the vast range of motion that those joints happen to do, which allows us to lift more and move better and so forth. It also, because of its length, provides a fairly large surface area for muscular ligaments and tendinous attachments. The articular surfaces on them, so the epiphyses tend to be very large, which provides a nice big surface for the kind of shock absorption. Imagine, take a 200-pound male and have him go for a run. You can imagine the forces of that body flying through the air while in a run that the hip joint and the knee joint would have to take, and how the femur would deal with that. So examples of a long bone, as I said earlier, is the femur of the leg, upper leg bone, the humerus, the upper arm bone, the ulna, which is a forearm bone, the tibia, fibula are found in the shin area. Metacarpals are in your hand, sort of part of your fingers. Metatarsals, which are your finger, the long bones of your feet, and then the phalanges being your toes or your fingers. So we see here in this example, this is the femur, which we see here, longer than it is wider, two epiphyses and so forth. The next, go from long bones to short bones. Short bones generally tend to be cuboidal in shape, meaning they're shaped like a dice that you would roll in a game. They're only found in the foot and wrist. They tend to be a transition between the long bones of either the lower leg and the lower arm, and the hands or the feet, the bones of that. In the foot, they are known as tarsals, and in the hand, they are known as carpals. And because they look like a dice that you would use in a game, they have 6 surfaces. 4 of those surfaces are used for articulation with other bones, and 2 of them are for a surface area for the attachment of muscles and or ligaments. So we see here are the metacarpals of the wrist here, and we see them down here, the metatarsals of the foot, and they are, so you can see this is a surface area for attachment. The direct backside would be another surface area, and then the 1, 2, 3, 4 areas here represent the surfaces that articulate with other bones. Flat bones are exactly that. They're flat. They're 2 plates of compact bone with a spongy bone and marrow in between. The marrow space in between these 2 plates of compact bone are known as the compact bone there is known as the internal and external cortices, but that center area is known as diploe. It forms walls of cavities. They're almost never flat per se. They usually have various degrees of curvature to them, but they provide a hugely broad surface for muscle attachments, such as example, the scapula is considered a flat bone, and there's lots of muscles that attach to that scapula. The other example is your sternum in the front, the cranial bones, so the bones of your head, not your face, the scapula, and then the ribs are considered flat bones as well. So we see here, for example, the sternum is a flat bone. Pneumatic bones. Pneuma is air. So these are bones that contain sinuses or air cells or space in them. What they generally tend to be is an outgrowth. These spaces tend to be an outgrowth of the mucous membranes, such as the middle ear and the nasal cavities. So when this bone is developing, it gets invaded by these mucous membranes that take over the space, and the bone doesn't grow there anymore. So above your teeth, on your top teeth, between your cheekbone and your teeth, you have a big space. The roots actually go up into a space there, and so forth, as an example. They fill up the facial contours without adding weight, and they provide chambers for voice resonance as well. So when we talk or sing, the noise that we make actually vibrates through these air spaces and adds to and makes the uniqueness of each of our voices. So we see here, this is the upper part of the jaw. This would be one of the front teeth here. It's cut in a mid-sagittal line. This would be above the teeth. This is part of the nose where there's no bone. You can see these big air spaces all through here. It's a very airy bone, which makes it very, very light. And you'll see it here. This is sort of the ridge over the eye. You'll see that there's a big air space. So you imagine this is all mucous membrane. How many of you have had a bit of a sinus infection or a sinus cold, and you get that really bad headache right at the ridge above your eyes? It's because all the mucous membrane in here is inflamed with the viral infection. It has no place to go. It swells, it gets irritated, and you feel it as a headache. Irregular bones are exactly that. They can't be grouped into anything. They just have these odd shapes that don't fit anywhere, so they're said to be irregular. They're very varied into how much compact versus spongy bone they have. The examples are your vertebra, which make up your spinal column, and certain facial bones that make up the bones of your face. So we see here, this is called the sphenoid bone, which is a bone at the base of the skull, makes up parts of the sides of the face. And here is a vertebra that belongs in the spinal column. Sesamoid bones are exactly what you think. It means they're shaped like a sesame seed. So they tend to be round or oval, and they develop where tendons cross over ends of long bones. They do two things. The first is they protect that tendon from getting too worn as it crosses over those two big bones. And the second thing is it changes the position of force, and in some cases makes a muscle seem more powerful because it changes the direction of that force. So the big famous one obviously is the kneecap, which is the patella. We have one on the first metatarsal of the hand, and we also have one called a pisiform bone, which is part of the metatarsal of the foot, pardon me, and the pisiform is part of the carpals of the hand. So we see here two sesamoid bones at the tarsal bone of the foot, and here is the patella of the knee. This is a slide on all the things that we might find on a bone. Bones are certainly not entirely smooth. This chart tends to show that there are a number of different knobs and bumps and lines and crevices and holes and so forth. And this is the basic name for them. So imagine you're an anatomist, you're dissecting a body, you look at a bone, and there's a hole in it, and it happens to have a groove, and it's got a big knob that sticks out of it. Then that would, under this chart, give you a sense of what you would call that structure. So a fissure is a narrow cleft-like opening between parts of a bone. The fontanelle is only one place, and that's in the newborn child. This is the connective tissue soft spots in a baby's head. Foramen is a small hole or opening. We find blood vessels and nerves there. A fossa is a depression in or on a bone, whereas a groove or sulcus is a furrow that accommodates a soft structure. The meatus is a much larger hole than a foramen. It's more tube-like. Sinuses, I've already talked about, they're air-filled cavities. Processes can be any prominent projection. Now, as part of this chart, when we look at processes that help form joints, they have their own specific names. A condyle is a large, rounded articular prominence, whereas a facet is a smooth, flat surface, and a head is a rounded articular projection supported on a neck or a constricted portion of bone. Please get to know these. I will be asking questions on them, and they will relate to the bones that we're seeing in class. When we look at the skeleton, it's divided into two areas. There is the axial skeleton and there is the appendicular skeleton. The axial skeleton is on a longitudinal line on an axis that runs through the body's center of gravity, so from the head right down through. In this division, we have the skull, the bones found in the ear called the auditory ossicles, the hyoid bone, which is found in the neck, all the ribs, the sternum, and the spine. It is this first area that we are taking in this first semester of Clinical Anatomy 1, all the anatomy, muscles, and soft tissue relating to the axial skeleton we will be taking this semester. Whereas next semester, in semester 2, Clinical Anatomy 2, you will be taking all the structures of the appendicular skeleton, which is all the other bones that are not part of the axial. This is the upper and lower extremities, the arm and the legs, and the girdles that attach the two divisions together to the axial skeleton. There are 80 bones in the axial skeleton and 126 bones in the appendicular. So at the end of 2 semesters, you will know them all. In this semester, as I said, we're focusing on the axial skeleton and its muscles, ligaments, etc. So the blue is the axial, which you're going to be taking this semester, and all the yellow or gold, whatever you want to call it, that's what you'll be taking all next semester. Thanks again for listening, and we'll see you next week.